Thank you, Kat and Celine. Mga kasangbahay, usapang pangkalusugan natin ngayong araw. Kasama pa natin ating chiropractor. Walang iba kundi si Dr. Rob Walcher. Good morning, Doc Rob.
Good morning,
Welcome back to
Doc
the
Rob.
show.
Great to be back.
Doc Rob, please greet our viewers over
Magandang umaga.
here.
Hello, everybody. Great to see you.
Good morning, Doc. Let's talk about chiropractic
Yes,
care and how
again.
how does our spine benefit from all this chiropractic care? Let's for those to start off, Doc, what exactly is chiropractic care and how did it begin? A brief
Great
history about
question.
chiropractic.
Yeah, chiropractic actually began in America, in Iowa, USA, in 1895. A guy by the name of D.D. Palmer, he saw a correlation with spinal abnormalities or poor posture and how that could affect one's health. And so he started to help people through just doing this manipulation of the spine. He started to help people with these conditions that they weren't getting help medically.
Okay.
And so everyone was quite astounded by this. And in the early 1900s, they actually went to jail for chiropractors. They went to jail because they were like, oh, these guys are practicing, voodoo, witchcraft.
really?
They were helping people through this manipulating of the spine. So it's a really great story of the Palmers, D.D. Palmer, B.J. Palmer, and that is the best, in my opinion, the best chiropractic school in USA, Palmer, and that's
Palmer
the
School.
founder of chiropractic.
Oh,
That's where I went. Yeah. So there's many different chiropractic schools in USA. But anyway, that's the beginning of chiropractic. So chiropractors, we are doctors that diagnose one's spinal problems or their condition. So we must be able to diagnose somebody that comes in, whether they had a stroke or they have Parkinson's or they have ankylosing spondylitis or a bulging disc. And we diagnose them and we then use our hands and manipulate. We adjust one's spine, the joint, to improve the nerve and how it operates. So our goal is to help you naturally. So we do not prescribe medications. So that is
So,
chiropractic.
Doc, how does it differ from traditional medicine and physical therapy?
Yeah, good question. Okay, so medicine, of course, you go to the doctor, they're going to do a diagnosis, and then they're going to give you a medication, right? A physical therapist, they're going to more or less work on your muscles, right? So they're gonna talk about weakness, and we need to strengthen, right? Chiropractors, we focus on the spine. And the reason we focus on the spine is because that's where your nerves are, your spinal cord, right? So your very important organ called your central nervous system, that is your brain and your spinal cord. Okay, it's encased in bone, right? The skull protects the brain and then the spine protects your spinal cord. And so what happens is we have stress every single day, gravity, what we do for work, how we sit, how we sleep, backpacks, falls, gadgets, lahat.
Lahat, yeah.
Everything is stress, and that accumulates on our spine and it affects your central nervous system. And that, in our opinion, is what creates the problem. The muscle spasm, the injury, the sprain strain, the back pain, the numbness tingling, the headache. Okay, so we don't treat those problems, we don't treat those symptoms, we adjust the spine, and we improve the nerve, and we allow the body to heal. So that is chiropractic.
Doc, there are many people thinking that chiropractic is just about bone cracking.
Right, yeah.
So what's the real science behind
Yeah.
the chiropractic care, Doc?
Yeah, especially now with social media, you're seeing so many people with millions of followers because they do all these crazy cracking of the joints, and that's the one thing I try to get clear in my marketing is chiropractic is not about cracking bones. Cracking your elbow and your knees and your fingers and your toes. We chiropractors, we are taught to be very specific with our hands, and we're gonna adjust a specific joint. And the reason we adjust that joint is to improve the nerve. Okay, so if somebody comes in, a child comes in with asthma, right? We know that specific nerves in the thoracic spine communicate with the lungs. So we're going to be specific with that adjustment. Somebody comes in with acid reflux or allergies. So we change our location of the adjustment depending on the condition. And that's, again, why it's so important to go to a real chiropractor, because these are the things that we're taught in school. And so we learn about every single nerve and where it communicates with and how it can affect the function.
So, Doc, I remember that you adjusted us before, but what is that specific popping sound?
Popping, that's air. Like when you crack your knuckle, it's just air. So in between our joint is space. And air molecules, little bubbles, accumulate in between space, right? Same thing with our knees, our elbow. Sometimes you'll hear your knee pop.
Yeah.
It's the same thing. It's just air kind of bursting, bubbles are bursting. So same thing, when we adjust your joint, it's just the air escaping.
Okay.
Yeah, it's nothing is breaking or cracking.
Nothing serious.
Intentional. Like,
No, how does chiropractic treatment help improve overall wellness, not just relieve back pain?
Yeah, so really that is the big picture. Chiropractic is about wellness and prevention. So all of these stressors we spoke about a moment ago, they accumulate, and over time they lead to malfunction. So they lead to the back pains, but over time they do affect our health. Because remember, the nerves here are communicating to the heart and the lungs and the liver, the kidneys. So this creates inefficiency and it creates malfunction. And so these adjustments are going to improve that communication to those specific organs. So it allows your body to work more efficiently. It allows your immune system to fight, bacteria and viral invaders, because we're allowing everything else to work more efficiently, so it makes you stronger from within. So studies show chiropractic regular adjustments really reduce sickness, right? So I've been adjusting my kids since birth. Ever since they've been born, we adjust them regularly, and they rarely get sick. If my kid has a fever, we do adjustments. Yeah, so we don't run to the medicine cabinet and take medicine. So chiros, we're not really taught that. Most people, we take medicine, right? So we really try to do everything we can without taking medicine.
Doc, I remember you before you brought a diagram showing the spine and the nerves connecting and what organs are affected on that specific area. But what causes those misalignments on those certain sections of the spine?
Yeah, so
Is it always injuries or physical traumas?
It can be physical trauma, falls, but it also is just repetitive stress.
Okay.
Oftentimes especially as children, we start off like all the sitting and slouching and the backpacks, and now the gadget. Think about how often you see kids, they're like this. And so what happens is they're going against the natural curve in the neck. We're supposed to have a curve here from the side to support our head, but what happens is we tend to go forward. So we're supposed to be back like this. So if we're like this, we're going against the natural curve. Right, and then that's going to create headaches. Of course, if your posture's like this, it's creating all this congestion. Allergies, rhinitis can very easily be improved through natural adjustments. We just adjust the joint, we free that area, communication is restored, child is much better, not getting sick as often, no more rhinitis, allergies, asthma, all of that.
Doc, you mentioned that you adjust your children since birth. Who can benefit the most from chiropractic care, Doc?
Really, everybody that has a spine. We all have stress.
All of us.
Right? We all have the same types of stress. Gravity's pushing down on us. We cross our legs. We sleep in strange positions. We sit in traffic all day. We sit at the computer, right? So we have these stressors. And then you take into account all the chemical stress, right? So those are things that we're taking in, like pollutions, sugar, poor diet. All of these stressors are going inside. Again, adjustments kind of help alleviate that and improve the operation.
So it's up to what age?
Okay, yeah. So we have babies all the way. I have 92 at the moment. I have a 90-year-old. Yeah, so we have to do obviously a consultation and examination, and we go through some range of motion testing. And if the person cannot be adjusted, then we would not adjust. Like if the joint has fused already, then we can't adjust them, because that is what's happening to us as we age. Our spine is degenerating, right? That's why we get stiffer. And so when I have somebody that's over 60, there's a lot more arthritis, spondylosis in their spine. So once they hit 70, 80, 90, sometimes it's fused together. There's no more joint. You notice like some, grandma, grandpa, they can't turn their neck, right? Because the joints have fused. And so if I can no longer adjust the joint, then I can't help them.
Doc, are there other conditions that are set a patient to be deferred for chiropractic care? Like you mentioned ankylosing spondylitis.
Yeah.
And what about those with osteoporosis or osteoarthritis? Those with degenerative spine. Is it still safe for them to undergo chiropractic care?
Yeah, great question. So osteoarthritis, that is where our joints decay due to stress, abnormal stress. So oftentimes we get it in our knees, we get it in our spine, right? So that's where the disc in between the vertebra starts to wear down, right? That's called osteoarthritis. Certainly, chiropractic, that is what chiropractic is for. We're going to help slow that arthritis in your spine, So we're going to get motion in the joint, and that's important because our joints get nutrients when they move.
Nice.
When we move our elbow, our shoulder, it gets nutrients called synovial fluid. Same thing with our knees, our vertebra. So by getting movement, we keep it healthy. So we slow osteoarthritis. Now osteoporosis, that is where our bones get weaker as we age. So certainly, of course, we need to use much less force. So babies and elderly require very little force. I don't need to put a lot of effort and be very aggressive. We can still help just with very gentle adjustments. So we use different force depending on who we are adjusting.
Doc, how about pregnant women? Is it safe to have their chiropractic care?
Yeah, chiro is great for pregnancy. Obviously, mom has a lot of stress because increased weight anterior pulls
Back
on the
pain.
spine. So we have back pain, they have numbness or sharp pain down their leg. So the adjustment will alleviate that. So mom will feel good. 2, by keeping the spine and the pelvis moving properly, the pelvis is able to dilate faster. So it actually speeds up the birth process, right? 3, it's going to reduce the chances of a C-section because you want a natural delivery. It's much better for the baby and mom. Yeah, because the pelvis dilates, so it really lessens the chances of a C-section. So that's 3. And 4, it's good for the developing embryo to get the adjustment, again, because the nerves are communicating. So 4 amazing reasons to get adjusted while pregnant, yes.
Doc, talking about all these benefits of chiropractic care in our lives, how often should someone visit a chiropractor to maintain their good health?
Yeah. So first, usually when someone comes in, they're 30 or 40 or even 20. And so that is some time of accumulative stress. So we might want to see them 1 to 3 times a week at the beginning to get them better. So we want to do these specific adjustments to get everything pantay, to get everything good, get the motion back, and to get the nerve communicating so they heal. Then after that, you can transition to a maintenance. I recommend at least 1 time a month to get adjustments forever.
Yeah.
It's like a car, you got to take care of your car or it won't run properly. Our body is the same and we only have one body. So at 50, if you want to feel great, have less shoulder problems and back problems and headaches, then you need to care for your spine.
Doc, since we're talking about physical pain, one of the most hot topics right now, the hot issue is about mental health. How does chiropractic care contribute to mental wellness, Doc?
Yeah, that's good. Chiro indirectly helps kind of everything. If you start to feel better and you start to sleep better, that possibly could really help. It gets you outside, it gets you active, exercising, doing positive things. Because I do have people come in with bipolar, anxiety, obviously depression. So we can help by targeting specific nerves that communicate with hormones like the adrenals and things like that. So we can help in that directly, but indirectly just by sleeping better, better
Quality
energy,
of life.
getting into exercise. And then in my clinic, we really promote nutrition and exercise. So we are talking about those things. And indirectly and directly it can help.
But Doc, how important is it to find the real or legitimate chiropractor?
really
And what are the risks if you go to a fake chiropractor?
Well, of course, if you go to a fake chiropractor, you possibly could have something going on that you shouldn't be there.
Okay.
You should be at the hospital. So 1, a real chiropractor should be able to diagnose if you're in the right place. And then 2, if you go to somebody, you can pick her up and crack her spine, right? Anybody can do that, right?
That doesn't make me a chiropractor.
Yeah. But what I'm saying is it's safe. It's not like you're going to kill her by doing that. For the most part, it's even if you go to a fake one, it's probably, and you see a lot of fake ones here, right? And they're able to adjust people and they've learned these adjustments on YouTube. But there's no intention. They are not specifically adjusting a nerve.
Okay.
They're just adjusting a joint to get the tunog, to get the crack.
The crack.
So most likely you're going to be okay. But you saw something happen, remember last year in the province. Do you remember that?
I realized,
Right? Somebody died, he cracked her pelvis and they ended up dying. So of course it can be quite risky. You want to go to somebody that really knows what
Doc,
they're doing.
how can we check if we are with a real chiropractor? Because in the Philippines, who gives certification
Right,
for our chiropractor?
Yeah, there is a company here or a department called PTOC, Philippines Institute Alternative Health and Wellness. something like that. P-Talk. That's who we must go through once we come to this country, because there is no chiropractic school here. That's why most of us are foreigners. So they do the vetting for you guys. They make sure we really went to chiropractic school and that we have an active license.
Okay.
Yeah.
So it's called P-Talk. You can go to the P-Talk website. And there you can see all the chiropractors in the Philippines that have a P-Talk registered. And every year we must maintain that, etc.
That's very, very important to take note, Doc.
Yes.
And for all our viewers, please take note that chiropractic doctors are certified by the Philippine Institute of Traditional and Alternative Healthcare, which is under the umbrella of DOH. And speaking of PTAC, they will have a General Assembly on November 18 and 19, 2025. Please check their social media for more information about the event.
Okay,
Yeah.
so yes, Doc, going back to our discussion, why is it important, Doc, to get consultation before proceeding to chiropractic session?
Yeah, I mean, the
before the
consultation,
tracking.
that's like 80% of it, because we need to know you. We need to find out, what's going on, what brought you here today, your
Yeah.
age. And we can learn so much just by looking at the patient.
I remember
their
the
posture.
when we did that.
Yeah. Yeah, so the consultation is very, very important. And then, of course, the examination, the evaluation, the palpation, that's where we piece it all together. But when you've been doing this for so long, I can just hear somebody's symptoms, see their age, see their what they look like, and, I can really learn everything about what's going on. Yeah.
Doc, who are candidates to undergo chiropractic and who are not candidates or it's not recommended
Yeah.
for them?
So really, I mean, anybody that feels that they want to improve their quality of life, how they feel, if they're having symptoms, of course, if they're having back pain or reoccurring injury or headaches, these are all candidates for chiropractic. If you don't want to just do the normal, take medication, chiropractic is the most effective way to get better without taking a medication. So we help, herniated discs, we help really severe conditions, ankylosing spondylitis and stroke victims, and Alzheimer's and Parkinson's. So we really help just kind of revitalize the body from within. People that cannot go really is very few. There's only a handful of people throughout my time, 25 years I've been doing this, where I said, I can't help you. It doesn't happen often. So it's quite extreme cases. So I always tell people, because people say, oh, my father is 80. Can you help him? Well, you need to bring him here. I need to be able to see.
Yeah.
If they are still thriving and want help, then I can most likely help them. Yeah.
Yes, and Doc, we've heard you'll be showing us a chiropractic
Oh.
demo today.
The lucky candidate.
I offer a tribute. Volunteer.
Doc, can you tell us what kind of adjustment or technique you'll be doing and what is it for?
Yeah, so I did my training in Palmer, and they really teach what's called diversified, so we can adapt to everybody's spine. I can do adjustments standing or seated. I really prefer to do lying.
Okay.
It really allows me to be much more specific and effective
All right.
with the adjustments.
All right, Doc, for our viewers, let's pretend I'm your patient. Let's do the standard procedures of your when a patient goes to your clinic, and what is the order of the
Sige.
steps and what we do.
The order we do things, we do the consultations.
Okay,
so
let's
they
do
fill
that.
out a
Okay.
form. So you
Form.
fill out a form.
Maybe
Because it's
let's
kind
just
of
talk about the form.
we can just do a very brief, because that would take
Okay.
a little, like 15 to 20
Okay.
minutes. So we can just basically, let's find out your age.
I'm 30 years old. Doc.
Are you suffering from any issues?
Issues, maybe back or shoulder.
Konti lang
Yeah, upper back pain.
matigas dito.
Stiffness.
Sakit ulo.
Shoulder.
Sometimes though.
Once a week, once a
I
month.
have I dislocated my shoulder before.
Okay, in the past.
Yeah, in
But
the
it's
past.
currently not.
I currently located.
It's located in its position. That's good. All right, so konti lang sakit
Yeah.
ulo. Once a week, once a month.
Once a week.
Once a week. That's
that-
pretty
yeah.
big. Okay, yeah. So these are all signs, that there's stress accumulation. And so just by looking at you, I can see, kind of slouching, right? That happens. We tend to slouch. If you want, why don't you have a
Shoulder.
seat
Oh,
here?
okay.
Yes, have a seat
Oh,
here.
Hi,
so we can
Rene.
show
Go,
them.
Joshua.
Doc, he has also rhinitis.
Okay, so you get sipon often.
Allergies.
Allergies. Okay. Yeah, so the one thing that jumps out at me is you kind of slouch a bit. So we should be a little bit more like this, right? That's how we should be. So
That's
the
how
lumbar,
that's how far my
But that's not
My posture.
comfortable, right? When you do that, that's not comfortable.
Or-
When
yeah.
because you're
I have to force
you
myself
have
to be
force
like
it.
this.
Because now what's happened is your spine has become used to being like this. And so what we do is we do these frequent adjustments to get that to come back. So it's going to become much more
So be like
natural
this.
for you to have that nice straight position. And then our goal is to bring the shoulders back. And then, yeah, we want to bring the head back. Yeah, go ahead and patanga, yeah. So the headaches are usually due to a loss in the natural curve here. So the head has come forward, so all that weight is accumulated, and then we get the headaches. Yeah. So we're just going to check here, do a little palpation. So we got a little congestion on that right. Yeah. Okay, so let's do this. Are you ready?
I'm ready.
Okay, let's do dapa. So you're going to start off dapa.
Oh.
Parang hindi ready,
Papa.
Joshua. Tingin nga na ready.
Ready?
Ready,
We'll just do some general adjustments here.
Marinig kayong tunog, no, sa mic.
Oh. Pwede
ASMR.
marinig sa ano ni
Talapin
Doc.
ni Doc.
Lots of SMR, yeah. Okay, so let's see. We're going to look at the hips. We'll start with the leg length.
Pantay po ba?
Is it
Is it
pantay,
pantay?
Doc?
Medyo
His
konti
legs?
dito.
Pantay,
yeah.
Doc.
Remember, Ira, when we first went to Doc Rob? His her balakang pala. It's not
Hindi
pantay.
It's not pantay.
Yeah, so he's a little bit off, medyo mahaba. Yeah, and then so the hips are a little bit off here, which is a common thing. Think about all the times bending and twisting and playing sports when you're a kid, falls.
He used motorcycle, Doc, and he drives car. Ako yung mama niya.
Alam na alam yung buhay ni Joshua.
Okay, so we're gonna adjust the sacrum here, his tailbone, and then we'll go over here. Okay, so let's go here. Let's go tagilid towards me. Harap sa akin. Yeah. There you go.
Naalala ko
We're gonna adjust
tuloy
his
yung
tailbone
adjustment
right
natin kay
here.
Doc, eh.
Good.
So, Doc, what is this adjustment for? What will it do?
So your tailbone is a little bit tilted, so and then your ilium, this bone is a little bit rotated. So you've got a little bit of a leg length issue. One leg is a little bit longer than the other, and your hips are off. Balakang,
Okay.
hindi pantay. So what we're going to do is we're going to adjust the sacrum and the ilium, kind of get movement back. Because right now it's not moving properly. Remember I said earlier, the joints need to move to get nutrients. So certain
Okay.
joints are not moving, so we need to get movement. And then there's all kinds of nerves down here. The reason the muscles are tight is because your spine is not in a good position. So the muscles are now matigas.
Okay.
So the adjustment, the nerve will tell the muscles to begin to relax.
Okay.
Are you ready, Joshua?
Ready?
Yan na, oh.
Here, dito. Hingang malalim labas. So we're gonna adjust the sacrum. Labas. Good, I got you. Okay, kabila.
Ano, Joshua? Inantok agad. Inantok agad.
Ang lakas! Ilang taon yung inipon niya.
Hindi ganyan kalaki
Yeah, I gotta
sa
come
atin,
around.
Kaya nga.
I'm a little conscious about the cracking, Doc. They might think it's not the bone.
Now they know. All right. Are we good? Okay, so here, remember we want the lumbar to go forward, right? So you have that nice seated position. So we're going to work on pushing that forward so you have a better seated position.
Okay.
So these are the lumbar vertebrae here. Take a deep breath and exhale. Good. Okay, now you're going to go face up. Higa.
Sarap.
Baba konti.
Sarap nun.
Baba konti. There you go.
Yun.
Pati ako
Okay,
napapa.
that was great.
Inhale, exhale. Pag sinasabi ni Doc, inhale.
Si Joshua, chill lang. Parang ako yung kinakabahan eh.
So far, so good, huh?
Yeah, Doc.
Yeah.
Very good.
Moving easy. Masarap, yeah. Okay, so then remember the shoulders are rounding, right? So we want to kind of start to bring them back and we want to adjust a couple of joints in your thoracic. So we're just going to allow our body weight to do this. Okay, take a deep breath and exhale. Very nice. That one is so great because it just kind of alleviates all that stress across the back, the shoulders that we often get.
Yan na.
And later he's going to want to take a nap.
Yeah,
Doc, I have to admit, I crack myself sometimes, but I've never cracked certain. What you've cracked today, I've
You didn't
never
crack.
cracked them before.
But you do that. Yeah, sometimes we feel the urge to crack our own back. Yeah. Okay.
This time, neck naman.
So now, here we want to improve this natural curve. So this is what's causing your headaches and allergies, all this congestion right here at C1 and C2.
Ready. Wow.
Good.
Na.
And now we're going to go down a little bit lower, C5 and C6. Okay, again, working on the natural curve in the neck.
Si Josh, inaantok na siya.
I heard that.
Nice. And what will he feel, Doc, after all of this?
Yeah, probably gonna feel looser and lighter. He's gonna notice he's already sitting a little bit better.
Yeah.
But one thing that's important to say is we haven't really realigned his spine. That's not really what's happening. When we do the adjustment, it's not like then your spine is in proper alignment. Because these issues have been there for decades,
Yeah.
right? So in order to really change the alignment, for a lasting time, it really requires a repetition. We have to do it over and over again. Think of it kind of like braces on the teeth. You wear braces for 1 to 2 years. Chiro takes a few months to really change the alignment. Yeah, so that's what we're going to do today with Josh. Just some general, simple adjustments, just to get you revitalized. Okay, you're all set. Tapos na.
right.
Yeah.
So this is the start, Doc. We
is
have
the
to
start.
really constantly visit our chiropractor if we want to see
If you want to
results.
change it, if you want to change things, then we're going to need to see you weekly for a period of time to change your alignment. But the reason, just to kind of go over some things, when you have these misalignments, it's going to lead to frozen shoulder, right? It's going to lead to the headaches. But if you want to change that, you really need to focus on the spine, because everything comes back to the spine. That is the frame of the body. Yeah. Good job.
Thank you, Doc. Thank you so much.
How do you feel?
Mamaya, pakita na niyan.
Reduce the sometimes I feel some pinching here and some
You
stiffness.
get those joints mobile, and it's just
Yeah.
like everything feels good. Your recovery is going to be better. Your exercise,
All right, Doc. A few advice for our viewers who are interested to visit your clinic.
Advice for our viewers that want to. So if you are really contemplating chiropractic, or if this is something that resonates with you or interested in, you should definitely come to one of our branches. We have 5 clinics. We have Quezon City, Makati, Alabang, Cavite, and Pampanga. You can go to our website at docrob.ph. That's docrob.ph, and there you can learn about our locations, our hours, our doctors, and get the best experience. So come and see us.
Thank you so much, Doc Rob. Doc, can you promote your social media handles?
Yeah. Go to my Instagram, DocRob74. That's DocRob74. I try to give some educational tips on nutrition, exercise, of course, the value of chiropractic. So try to make it a motivational thing.
Doc, do you have anyone to greet today?
My asawa's here.
Good morning, Miss Patricia.
Patricia's here.
Morning.